here on the night team, it is called the silent surge. Men in their 30s being diagnosed with colon cancer.
7 investigates why their symptoms are often misdiagnosed. Here's the night team's Courtney Allen.
34-year-old Rory Kennedy was on top of the world, married with a newborn and living an active life.
When you're, in your 30s and, you're living a life where you're just on the go and you work out all the time, you eat well. I've never had any health issues.
He felt great with perfect blood work and no reason to worry until he started experiencing bowel problems and went to see a doctor.
I had black tarry stools. They just thought that I had a ulcer. So we did some testing, they gave me some antibiotics, and symptoms went away pretty quickly.
But 2 years later, his symptoms came back. Doctors performed a colonoscopy and endoscopy. The test revealed he had colon cancer.
Surgery was scheduled for almost, just 2 weeks later. 4 weeks after that, it's chemo, and chemo's for 6 months.
Dr. Kiranmani Mutasani at Mount Sinai Medical Center is seeing more and more young colon cancer patients like Rory.
I've seen a significant increase in the numbers. The youngest patients that I've diagnosed is as early as 26 years old.
She says diet, environment, and genetics can play a role, but the mindset of younger men can be part of the problem.
It's not something that they want to talk about, especially men. They're like, do I need it? It's not necessary. Or they'll give you 1,000 arguments about why they're fine.
But it is a serious problem. The American Cancer Society recently lowered the age for a first-time colonoscopy from 50 to 45 because catching colon cancer early is a key to survival.
So let's say you find a polyp that was just beginning, like precancerous polyp, and you remove that, and that's an absolute prevention of a colon cancer.
Dr. Mutasani says it's tough to get younger patients to understand their risks.
Listen to your body. It's extremely important that you listen to your body. If you feel something is persistent, when I say persistent, it's more than 3 months, it's not going away, ask yourself a question, are my symptoms getting better, worse, or the same?
A few months after Rory's first surgery, doctors found 2 more tumors on his liver, which put him at a stage 4.
The percentages aren't good, but I do know people do beat this. You really don't have another option. I mean, you got to keep going, right? Especially when you're younger and you have a wife and a kid.
He wants other young men to hear his story, so if they're experiencing any symptoms, they seek out an early diagnosis and early life-saving treatment. Courtney Allen, 7 News.